Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the Norma verticalis, that is the superior view of the skull. The Norma verticalis is oval in shape. Following bones are visualized in Norma verticalis: upper part of the frontal bone anteriorly, uppermost part of the occipital bone posteriorly, one parietal bone on each side. Suture will get suture. These are the fibrous joints, saw-tooth-like fibrous joint. Between the skull bone, we have the coronal suture, sagittal suture, lambdoid suture, and metopic suture may be present in only 3% population. Okay, so if you go there, if we go to show that, so this is the superior aspect of the skull, that is the Norma verticalis. We have the frontal bone here, then we have on two sides we have the parietal bone, one here, another one, and posteriorly we have the occipital bone. Here is the occipital bone, upper part of the occipital bone. This is the lambdoid suture here. We have the sagittal suture, and we have the coronal suture. Here is the coronal suture. We have the coronal suture here. Okay, so we got the suture and the bones. If you go to the next slide, we'll go there. Here is a very much nice way presented by Netter's Atlas. This is the reference. Okay, so Norma verticalis, bones, frontal bone. This is the frontal bone. The parietal bone, this is one parietal bone, another parietal bone, and the upper part of the occipital bone is here. We have the suture. This is the coronal suture between the posterior border of the frontal bone and anterior border of the parietal bone. This is the sagittal suture between the two parietal bone here in the median plane. Good. Here we have the lambda, junction between the sagittal suture and the lambdoid suture. Okay, so there is the lambdoid suture, one end, another end. This is another end. This is the lambdoid suture. So, and this is parietal bone, another parietal bone, frontal bone, and the occipital bone. We got the suture, we got the bone. We have some foramen on the parietal bone. Here is the foramen here, small foramen for the emissary vein. Okay, and if you go to the next slide, we'll go there. If you go to the next slide here, suture, we just discussed that coronal suture is located between the frontal bone and two parietal bone. Sagittal suture is placed in the median plane between the two parietal bone. Lambdoid suture lies posteriorly between the occipital bone and the parietal bone. Metopic suture occasionally present in 3% population in the median plane separating two halves of the frontal bone. Okay, so we may not get always metopic suture. It is only present around 3% population. Okay, so this is the Norma frontalis. This is the coronal suture here. This is the sagittal suture. And we have the lambdoid suture going down. Okay, so we got that. If you go to the other inner surface of the vault of the skull, that is the calvaria, we'll find out the groove for the superior sagittal sinus, that is the dural venous sinus, and here also granular foveolar impression for the arachnoid granulation. Here by arachnoid granulation, arachnoid villi, the CSF from the subarachnoid space reaches the superior sagittal sinus. Okay, so we got that. Here is a part of the skull bone. Over it we have the scalp. Scalp has multiple layer, 5 layers, as SCALP: skin, connective tissue, aponeurosis, loose areolar tissue, and pericranium. Okay, so we got the scalp here, and we have some vein that connect the skull vein with that of the dural venous sinus. This is the superior sagittal sinus, okay, and it is connected to the skull vein by means of emissary vein. Emissary vein has no valve, so there may be spread of infection from outside the inside is possible, okay, because these are valveless. Blood can flow in both directions. Okay, the purpose of emissary vein is to equalize pressure. Okay, we have also the diplo space because this is a flat bone. It has outer table, inner table, and spongy part or cancellous part that contains some venous spaces. We call it, or you can call it small venous sinuses. We call it diploic veins. Diploic vein may communicate with that of the skull vein or may communicate with the dural venous sinus. Okay, so this is confined to the cancellous part with communication both way. Here it is going from the skull to the dural venous sinus. Okay, so we got the layers of skull. The emissary vein equalizes pressure. It may be the route of infection. Diploic vein may be the route of infection. Okay, here is the dural venous sinus containing venous blood. It receives cerebrospinal fluid by arachnoid villi and arachnoid granulation. Okay, so collection of villi is the granulation. Here, this is the subarachnoid space containing cerebrospinal fluid. This is the dural venous sinus. This is the superior sagittal sinus. Okay, so this all forms the calvaria, outer table of bone, inner table of bone. In between then we have the cancellous bone, diplo or cancellous bone containing diploic vein. So here outer table, inner table, diploic vein. Okay, we have some bony landmark that is important to us. Vertex, the highest point on the sagittal suture, highest point. Okay, here is the highest point, the sagittal suture. Vault of the skull, this is the vault of the skull. Then bregma is the site of union of the sagittal suture with the coronal suture, a point where one frontal bone meets with two parietal bone in an adult. There is bregma. But in case of newborn and the infancy, we have the anterior fontanelle, a gap between the frontal bone and two parietal bone, covered by a membrane seen in fetus and infants. It closes within 66 to 22 months. Lambda, the meeting point between the sagittal suture and the lambdoid suture. Superior inferior temporal line, okay, arch backward, upward, posteriorly, beginning at the zygomatic process of the frontal bone here, and it goes upwards, backwards, backwards, then goes downward. We have two lines over the parietal bone. Initially one line, one temporal line that becomes splitted to two temporal lines. So that superior temporal line disappear over the parietal bone. Inferior temporal line again goes down, reaches to the upper part of the mastoid process here, the mastoid process. So we got that temporal lines. Okay, so if we go to the previous picture, you can get the idea here. This is the point called bregma. It was a space covered by membrane, that is anterior fontanelle, in the newborn and infant. Okay, we have seen that in our previous image. Okay, here this is the anterior fontanelle. This is not ossified. It takes around 6 months to 22 months to ossify. In certain individual, it may be early at 6 months, maybe 22 months in another child. Okay, this is the metopic suture. It usually disappeared, present in only 2% population. So this is bregma, adult. In infant, this is area gap, no bony connection and no ossification here, just covered by membrane. This is the anterior fontanelle. it has a lot of clinical significance. Okay, anterior fontanelle, if it is bulged out, then we think the patient has increased intracranial pressure. It may be cerebrospinal fluid, it may be blood. Okay, if it is depressed, then we think, if this is depressed, then we think there is dehydration, maybe severe diarrhea. Okay, the posterior fontanelle closes very quickly within few months, but it takes time for this fontanelle to be closed. Okay, we got that. Now we'll go to the bony landmark again. This is the brecma area. Okay, then we got the vault, anterior fontanelle, lambda, the meeting point between the sagittal suture and the lambdoid suture, superior inferior temporal line, arch backwards and upwards, posteriorly beginning at the zygomatic process of frontal bone. They crosses the coronal suture on the parietal bone. Okay, they become two, superior temporal line and inferior temporal line. Inferior temporal line is continued over the mastoid process. Superior temporal line usually fades out. It disappears. Posterior fontanelle, gap between the parietal bones and occipital bones seen in fetus and in newborn, it closes by 2 to 3 months. Parietal eminence is the area of maximum convexity of the parietal bone. Okay, this is the parietal eminence here. One, another one is here. Okay, parietal eminence, and it is a site of fracture also. Okay, so parietal foramina on each side. Okay, here we have seen parietal foramina here, parietal foramina 1, another one is not shown in this bony model. Okay, so parietal foramina on each side pierces the parietal bone near its upper border, close to lambda, around 3 to 4 centimeters close to lambda. Parietal foramen transmits emissary vein from the veins of the skull to the superior sagittal sinus. Okay, the emissary vein, which are the vein we discussed, it communicates the skull vein to the sagittal sinus, or the cavernous sinus vein to the pterygoid venous plexus. Okay, that means the veins that at the base of the brain or the venous spaces, they are communicated to the deep vein by means of emissary vein. Okay, oblivion, the point on the sagittal suture between the two parietal foramina. Okay, we have some clinical anatomy. Anterior fontanelle we just discussed. If it is bulged out, indicates increased intracranial pressure, that may be cerebrospinal fluid, that may be blood in case of head injury. Okay, it may be this part may be depressed in case of dehydration, like severe diarrhea. Okay, this should close very soon, within 6 to 22 months. This should close by 2 to 3 months, posterior fontanelle. If it does not close, that means there is something wrong in the calcification process. Okay, sometimes it may close very much prematurely, like this. We'll get a boat-shaped skull, we call it scaphocephaly, due to premature closure of the sagittal sinus. Okay, we have other problems like that of here coronal suture. Here the sagittal suture is closed prematurely. Here coronal suture is closed prematurely. We'll get the brachycephaly, or maybe the tower skull. This is boat-shaped skull due to the premature closure of the sagittal suture. We have a lot of other combination of sagittal or the lambdoidal suture premature closure. We may get different type of combination of the suture. We'll get the plagicephaly. So the skull appearance may be altered. And that's all about the anatomy of the Norma Verticalis. If you have any question, please feel free to ask me. Please share the information with your friends. and please subscribe my channel. Please support me. Have a nice and wonderful day. Bye now.